Now, another two things you talk about, which is again, it's kind of that fascinating science fictiony. Oh wow, if we could do this, we could talk to animals, kind of thing. Is DCS, which is using current, and TMS, which is using magnetics.
Right.
They're very similar, and you talk about a little bit about how there's a little crossover between why one and why the other. Can you talk about those technologies, how they're being used, and what you're saying about them?
The transcranial direct stimulation, direct current stimulation is the one that strikes me as kind of holding the most danger, because it's one that people, you can just order a kit, please don't go do that, because the evidence base for it's doing anything that people want it to do is not as sparse. From what I could find, I had one neurologist who has a lot of experience with this just say, please don't go, experimenting with your brain. You order them, you put electrodes on, you zap your brain, and some place that allegedly is going to achieve the outcome you want, whether it's like feeling smarter or having, more, a greater attention or focus or whatever. And if you go and look at boards where people aggregate and discuss these effects, some of the things they say are really kind of like frightening. I lost my second language. I can't spell anymore. I can't find words, and all of that is anecdotal as well, but balanced up against the fact that there don't seem to be a lot of data to support it, I would kind of steer clear of that. I would go for a walk before I would put an electrode on my head and just kind of zap my brain and hope I was getting the right spot.
Yeah, because that's crazy. Because I'm like looking at, you and I don't wear the same hat. Um, so we bought a
Right.
kit. It's like, okay, we're talking about trying to fire off particular neurons, and those are not like big things. They're like little bitty things we're trying to
Yeah.
find and specify, and then
Yeah.
and we're trying to do it looking in a mirror.
The whole thing strikes me as just a little bit of a kludge. So I would not, run and spend the however much it is, $40. I mean, some of them are quite inexpensive, which might also be a bit of a red flag. I don't know.
Or the
So,
burns on your head.
or those burns on the head that they talked about as well. I'm just thinking, yeah, I'm going to try walking first and see if I get anything from that. The other one, though, that you mentioned is transcranial magnetic stimulation, and you cannot go and order this. Is a very pricey thing to do, and they have done some trials with these where they, for example, apply the stimulation and people see very transient improvements in how they perform on certain cognitively challenging tasks. And then it is also something that is used for depression, and that is a prescription kind of version of it. So that one shows more promise, and there's also a more controlled exposure. You can't
Yeah.
just go order yourself a TMS. I mean,
Well, and I think the reality of these things is that, you have doctors. If a doctor's working with you to solve a problem and they're using these therapies, then, they're coming from a place where they do this. They do this every year, every day, every week. And as a result, they have some experience with it. They know what some of the not to do things. And as a result, as a part of a protocol or a treatment, you understand that and say, okay, but if this is something you're trying to do on your own, neither one of these, even if it's accessible, is not necessarily in your best interest.
exactly. There's again, this is a situation where practice actually does make perfect. Just like you get better at doing crossword puzzles, the more of those that you do, you're right. Clinicians are going to have a level of expertise and understand how to map the brain and target the right place for something like TMS. That would be so. It'd be like trying to cut your own hair almost, to really get to the right place and get the kind of tailoring that you want for it.